Okay, now just for a quick practical demonstration on how nail surgery is performed, I'm going to start by explaining how the partial nail avulsion with venalization is undertaken, which is by far the most common operation, of course. So cold spray followed by an injection here and here. That will then cause the toe to go numb, usually within about 5 minutes. When the toe is numb, we test it to make sure it is completely anesthetized. And then wedges are removed from the sides of the nail according to how much needs to be removed to ensure that the nail grows back without any of those troublesome issues with the ingrown toenail. So what happens is that these sections of nail are removed, the areas in red. Now the nail actually goes to about here. So it actually goes underneath this fold of tissue, which is called the eponychium. So what happens is that I use a nail nipper, and then that's followed by a beaver blade, which is a small blade, and that then carries through right to the end of the nail underneath here. Then some forceps are used to remove that section of nail, and then everywhere where the red is, including underneath the nail, chemical is applied called phenol, and that means that those areas won't grow back, and as a consequence the nail will end up growing back exactly as it did before, but not where those red areas are. And as a result, this generally cures the issue of ingrown toenail. Now, as I mentioned, in some rare cases, it's necessary to do a different type of operation. And there are really two operations I perform where the nail is cut rather than using the chemical. But 90% plus of cases, we always use the chemical. One procedure I use is called the frost procedure, where I make a little J incision along the side, and the same for the other side, and then I flap that back and I physically cut the root out and I sew that flap back. Okay, and now a Winograd procedure, for those who are interested, is very similar, but instead of a Y, a total ellipse is removed. So literally everything in this red area is removed. And then, but right down to bone. So the whole section, that means if you take it down to bone, then you also remove the root, and then it's just sewn across with some sutures. But that again is less frequently used, and even less frequently than the frost procedure, which is actually my preference if I'm going to do a surgical procedure. So I hope that practical demonstration makes it easier to visualize.